So this is our ethical dilemmas project that we did, and we did it over professional boundaries, and it is with Lindsay, Schuyler, and I. So when do ethical dilemmas occur? When a person faces a situation in which they must choose between two or more conflicting morals, principles, and each potential action has significant ethical consequences. So, what are the ADHA Code of Ethics? They outline the ethical responsibilities that dental hygienists have to their patients, community, colleagues, and the profession. The code is designed to guide ethical decision making and promote trust in the dental hygiene profession. The main principles that are part of this is non-maleficence, autonomy, benefits, justice, veracity, confidentiality, and professionalism. So, professional boundaries in dental hygiene. The ADHA Code of Ethics are essential for ensuring the integrity of the profession, well-being of patients, and functionality of the healthcare system. And then here's our scenario.
Okay, so I'm just going to read the scenario that we had for our project. A male patient arrives for his 6-month recall appointment. The dental hygienist calls him back and directs him to the operatory. Upon greeting her, the patient remarks, "You look great." The hygienist acknowledges the comment professionally and redirects the conversation to his medical history. Upon reviewing the medical history, the patient has marked that he has high blood pressure, but states that he does not take any medication despite his primary care physician's recommendations for medication. The hygienist proceeds to take his vitals, which reads 145 over 95. She explains that his blood pressure is reading a little high, and the patient then jokingly responds, "It's your fault, you're making me nervous." The hygienist maintains professionalism and takes his blood pressure a second time, yielding a reading of 140 over 88, and determines he is cleared to continue care. During the cleaning, the patient continues to make personal remarks, commenting the hygienist has pretty eyes and asking, "Do you have a boyfriend?" The hygienist remains professional but begins to feel increasingly uncomfortable with the comments. She then steps out to inform the dentist before proceeding with the periodic evaluation. The dentist enters the room, greets the patient, and begins the exam. Before proceeding further, the dentist directly addresses the patient's behavior. Patient initially dismisses the comment and states it was lighthearted and it was nothing serious. The dentist iterated, "We want all of our staff and patients to feel comfortable during their appointments. Please keep the conversation focused on your oral health so that we can provide you with the best care possible." The exam is completed and a treatment plan is created. The patient is walked to the front to check out. After the patient leaves, the dentist advises the hygienist to document the incident thoroughly, including the specific comments made by the patient, the hygienist's discomfort, and the steps taken to address the issue, that the dentist was informed and addressed the behavior, and that patient will be scheduled with another hygienist or a male hygienist for the future appointments to maintain a professional and comfortable environment. So this is our ethical dilemma analysis of the scenario. So the key components to recognize with this ethical dilemma is that it was about professional boundaries. As the appointment continued, you could tell that the patient was getting more comfortable with his comments and making them more frequently. The patient does have right to quality care, but the hygienist also has a right to a safe and comfortable work environment free of harassment. The situation raises the question how much personal conversation is acceptable in a professional setting. So in this ethical dilemma as hygienist, there's many things that we need to take in consideration. The professional hygienist must balance providing quality care with professionalism in face of inappropriate comments. She must determine whether the comments are harmless or harmless battery or harassment, and determine when this intervention is necessary. You must notify the dentist to give an understanding of the situation, to receive feedback and provide intervention on the situation if necessary. You must properly document for legal protection and to track behavioral patterns in the case of further issues, as well as to determine how to handle similar cases in the future if the patient's behavior consists as coming back to the practice. So next, we're going to talk about the application of the ADHA Code of Ethics when it comes to this specific dilemma. The ADHA Code of Ethics provides a framework for ethical decision making. And in this scenario, multiple ethical principles were applied to the dental hygienist's response and the patient's inappropriate behavior while ensuring professionalism and respect was towards the patient. So the first one we talked about was autonomy and dignity. As we said before, the patient does have a right to receive care in a respectful environment, but as we said earlier, the clinician also has a right to work in a space free from discomfort or harassment. And by informing the dentist and documenting the incident, the hygienist protects her professional boundaries while ensuring the patient's treatment continues appropriately. The next one is beneficence. The hygienist still maintained a professional demeanor and focused on the patient's health despite his comments, as well as the dentist intervened, reinforcing it to his oral health, which is ensuring both the patient and the provider's well-being. The second one, or the third one, was non-maleficence. The hygienist took appropriate steps by seeking assistance from the dentist, rather ignoring her discomfort. The dentist intervenes to prevent further discomfort, ensuring a safe work environment without escalating conflict with the patient. Reassigning the patient to another hygienist could minimize harm and maintain professional standard of care. The next one is justice and fairness. The patient was not denied treatment based on his behavior, but instead the practice takes reasonable steps to ensure the hygienist's comfort while still providing care. So reassigning the patient to another hygienist ensures fair treatment while respecting the boundaries of the other hygienist.
Okay, and next we're going to look at the legal considerations of our scenario because as dental hygienists, we are committed to upholding to the highest standards of patient care and adhering to the legal and ethical guidelines established by the state in which we practice. And in analyzing the hypothetical scenario that we've presented, it's evident that both the hygienist and the dentist acted in full compliance with the Arkansas Dental Practice Act while professionally managing the situation without any legal infractions. How do I go? I'm not able to go to the next slide.
I change it to the next slide.
Oh, dude, I bugged out for a second. I'm so sorry. Um, the dentist upheld these ethical and legal obligations in practice by addressing the patient's comments respectfully while continuing to provide necessary treatment. The dentist fulfilling their responsibility by safeguarding their employees' comfort and well-being while preserving the dignity of the patient and addressing the behavior in a calm and respectful manner and ensuring proper documentation of the incident. In summary, dental hygienists play a crucial role in maintaining oral health while upholding ethical principles. Equally important is their right to a safe and respectful work environment. While most patient interactions are positive, challenges may arise that require ethical decision making to address behavior that causes discomfort. And by adhering to ethical standards and fostering professionalism, dental hygienists can ensure high quality patient care and workplace integrity.
All right, that's our presentation.